Adult patients with scoliosis are normally going to eventually feel pain as a result of their scoliosis progressing as an adult. And this is because the progressive factor is a result of gravity compressing the tissues, the spine, the nerves, and different areas around the spine that can lead to pain, causing pain. So therefore, if you can actually reduce what's causing the pain, which is the scoliosis, you can help them alleviate the pain and help get their body start functioning better, as opposed to just treating the symptom. I mean, if you just treat the symptoms with pains or drugs or injections, the curve is still there and the curve is still worsening. So once whatever they are doing wears off, the pain not only comes back, but it progresses over time. So not only are we reducing the symptoms, but we're actually addressing what's causing the symptoms, which is the most important thing, and allow their body to heal and function properly like it was supposed to.
After the accident, I was like, we saw a doctor normally, then said everything is good because I can bend my back, turn, everything was fine. And then after that, I started to feel this pain after a few years.
Like all patients, the scoliosis patients can be involved in accidents and injuries. And like with Armelle, we know she had an accident back in 2012 where she had this car injury, and they said that she's fine, that her spine can move and go on your way. But we actually have those films, and we actually can see that she actually has a scoliosis back then. But they didn't think it was a big deal, and that's because they don't know what to do with it. They don't know how to treat it. They don't think it's not big enough to put a rod in her spine, so just don't worry about it. And unfortunately, when you have a scoliosis and you go through an impact or an injury, it's kind of like an eggshell. Like it's easier to crack than if your spine was completely straight. So these forces, when they enter the spine, once you have a scoliosis, it's just a matter of time, and probably it's going to be accelerated now because of this impact, that they're going to start experiencing pain and symptoms sooner as a result of that. So it just compounded the effect of her problems, and she started feeling pain as a result of this issue, within a few years from this injury.
I'm a student, online student, and then using a computer, it's also so painful. All my works are online, so that didn't help. They're sitting in front of the computer. So, my husband actually heard about it, and then he said, wow, we need to, a lot of people are talking about it, let's give it a try, and let's go there. And I said, okay, let's go, let's see. And then when I came here, it's like, a bliss. Really good. It's really good. It went like take time to went to all the detail to explain to you to make sure you understand, and the staff are amazing. Yeah, patient with you, very amazing. When I first came here, the angle was like 40 degrees, and then 2 weeks, it turned down to 20.
So a reduction in a scoliosis is based upon two major factors. Number one is going to be the size of curve and flexibility of the curve itself. Meaning, if we have a 20-degree curve that's really stiff when we do our flexibility study, and it only reduces to 15 degrees during our flexibility study, all we're going to be able to reduce the curve is 5 degrees because that's the most flexible it is. But if we get a 20-degree curve and we do our flexibility study and they reduce to 0, well, now we have a 20-degree window. So if we get a patient like Armelle that has a pretty flexible curve to begin with, and we do our treatment, we can actually get a very large reduction in a short period of time. Across the board, our averages are about 30% reduction among all the patients I've seen, meaning from 10-degree scoliosis cases to as large as 155-degree scoliosis cases, and as young as a 5-year-old to as old as a 95-year-old, and everything, in fact, even younger than 5 actually. So everything in between is those ranges. So some cases change more than 30%, some change less. Armelle changed almost 50%. That's a higher than average, but it doesn't mean it's not impossible. So those things are achievable if the right circumstances exist in that patient.
Before, right away when I wake up, I started to feel the pain on my neck. But now, I barely feel the pain. A huge difference, huge. I can feel that too. I can drive for a long time, sitting down, sitting up. Yeah, make a huge difference.